So I'm going to talk about the Pentacam diagnostic tool within our practice. You know, we invested in the Pentacam back in 2005 in our refractive practice, and since that point it's been more or less the gold standard for corneal refractive surgery. The reason being is it takes a picture of the anterior cornea but also the posterior cornea, so you can get a true map of the eye, and you can get corneal thickness, pachymetry. It can help rule out pathology. Is there a weak spot, or is this early keratoconus or anything like that? So the Pentacam has been more or less the gold standard screening tool for corneal refractive surgery to assure this patient's going to be a good candidate for LASIK or PRK or now SMILE. That's been basically the gold standard for corneal refractive surgery. We've used it a little bit in cataracts over the past 10 years to help guide maybe toric lens positioning and things like that. But most recently, there's been an upgrade to the Pentacam called the Pentacam AXL. And what that allows is now the Pentacam is a true biometry device. It can take the axial length in addition to the corneal power. So now you can get axial length and corneal power to help pick intraocular lenses just like you would with any other biometry tool. Now it's one step. Instead of having to take a topography and then go over and do biometry, you're doing all that in one step, and then it'll give you that printout with the formulas that you're used to. So all the typical formulas, SRKT and Hoffer and Haggis, the Barrett formula, all those formulas are now on the Pentacam, and you can take that in one step. What we've found is that's really increased our efficiency. You know, typically in the past we would do 3 main tests. We would do topography or Pentacam, biometry, and let's say OCT. Now we can eliminate, or combine those 2 steps into one. So we're basically saving 5 or 10 minutes on each patient by having this efficient and very accurate measurement tool. What's also nice is now, when I'm sitting down with a patient, if a patient asks, Doc, do I have astigmatism? Do I have this corneal pathology? I can pull out the Pentacam, and it's my, kind of cataract preoperative diagnostic tool, and I can go through that and say, okay, based on your eyes, I think you're going to be best with a toric lens, or based on your eyes, we're going to pick one of these lenses that's going to best fit for you. So it's been a great tool, for patient education, but also to help increase sort of our accuracy and predictability of our results. One other added bonus for cataract surgery. With cataract surgery, we do a femtosecond technique where we have a LENSAR laser. The Pentacam can now stream its images to the LENSAR to guide for femtosecond incisions. So you can use that total cornea power that the Pentacam is determining to help guide the arcuate incisions to decrease that astigmatism. And those 2 devices are linked together, so you don't have to worry about pulling that information off, finding it, inputting it into the laser. It's just all linked together through this new streamlined process. So now truly the Pentacam is not only a refractive tool, it's a cataract and refractive tool.